Welcome to Arirang Live. It's after 2 p.m. here in Seoul, and I'm Kim Dami. In just a few minutes, we're going to cross over to the latest briefing from the South Korean health authorities on the COVID-19 outbreak. The briefing is getting delayed, but just a reminder, South Korea has confirmed 23 new COVID-19 cases on Saturday. 19 of the new cases are local transmissions, mostly linked to a local hospital in Seoul, as well as the Itaewon cluster of infections. With 2 additional deaths, the death toll stands at 266. Meanwhile, Daegu City has also confirmed an infection related to the Itaewon club cluster infections on Friday. A teenager visited Daegu after having been infected by a friend who went to a club in Itaewon. Health authorities are now working to identify the patient's routes as they visited several coin-operated karaokes and clothing stores in Daegu. The briefing has just begun.
Let us now begin our regular briefing for May 23rd, Saturday. We have 23 new cases as of yesterday, and the total number of confirmed cases now stands at 11,165. This includes 1,204 imported cases, and of them, 88.4% are South Korean nationals. We had 32 more people making full recovery, and currently 705 people are in quarantine undergoing treatment. Unfortunately, we had 2 more deaths as of yesterday, and I extend my deepest condolences to the bereaved and the bereaved families and the deceased. And out of the new cases, we have 4 imported cases, and of the origin, 2 are from UAE, 1 from Kuwait, and 1 from Bangladesh. And as we said, we are seeing 19 local transmissions, and in relation to club, there are 10 people, and others are 9 confirmed cases. However, relating to the club, as of today noon, we have more cases, 12 more cases, and the total confirmed cases of the club is 219. And most of them are from Seoul with 113. And in Chungcheongbuk-do province, there are 9, but 8 of them, they are related to a facility of the Ministry of Defense. And the visitors amount to 95 of them. And now we have 124 people who are the contacts. And the number of contacts far outweigh the number of club visitors. And we also have witnessed a bar at the Seochogu district in Seoul, and one of the family members and as well as 1 employee who are working at this bar has been identified as tested positive, and this facility has been visited by a confirmed case who is a nurse at the Samsung Medical Hospital. So we advise you, if you have visited the same facility at a same period of time, we advise you to go get tested at a screening clinic regardless of your symptoms. And in relation to this specific establishment, we have 9 a total of confirmed cases. Moreover, in Yangcheon-gu, Seoul City, we have a Grace Methodist Church, and there was an intern pastor who has been tested positive. And we also have more contacts testing positive at Gyeonggi-do province, and a total now stands at 7. And we are doing the epidemiological survey as well as investigation right now. Moreover, we also have some wards for the schools, and we advise all of the students, teachers, and staff to check their symptoms in the morning and stay home if they have fever or respiratory symptoms. They should also keep face masks on at all times while in school and strictly follow personal hygiene measures such as hand washing and coughing etiquettes. Moreover, if there is a confirmed case in a school, all students, teachers, and staff members need to wear the KF-approved face mask and must return home. It's the weekend, and the KCDC advises that the public to refrain from visiting clubs, karaoke rooms, bars, and after-school private academies. And this is because we have seen a recent rise in local transmissions in such enclosed spaces that are frequented by people. If you have to go to these facilities that are enclosed and confined and crowded, you need to keep 2 meters of distance. You need to wear your face mask at all times, avoid handshakes, wash hands, and do not touch your eyes, nose, or mouth with your hands. So this is very important to keep your personal hygiene measures. And especially if you belong to the high-risk groups, including elderly, over the age of 65, pregnant women, persons with chronic illnesses, you should especially avoid any poorly ventilated enclosed space frequented by many people. And during the weekend, the religious facilities and the houses of worship also need to take precautions, as there is a risk of exposure to a large number of people. Online or other non-face-to-face methods of gathering and worship are recommended. And if you host on-site events, you need to check everyone's body temperature, maintain distance between participants, require everyone to wear face masks at all times, and please refrain from providing group meals or engaging in activities that make respiratory droplets travel in air, such as singing and shouting. Anyone who has come in close contact with a large number of unspecified persons in an enclosed space, you also need to get tested as soon as possible at a screening clinic or through the Public Health Center or 1339 call center. And if you have 2 or more persons within your household or social group develop COVID-19 symptoms, you also need to get tested as soon as possible. Right now, COVID-19 pandemic is spreading globally, and the affected cases now surpasses 5 million. And we also see the COVID-19 pandemic being prolonged. And the situation in South Korea is also similar with the other countries, and we see on a daily basis new sporadic cases. And in early May, we have seen a cluster infection starting from a club, which is a high-risk facility, and this is now spreading from the metropolitan area to each of the municipalities. So this means that we need to stay vigilant continuously. And in particular, as for the cluster infections, it is very important to win over time. And we are currently conducting massive and swift testing, as well as a thorough contact tracing. We are exerting our full efforts to trace the links of transmissions and the chains of transmissions. And the quarantine authorities aim to control and manage the situation within our scope. However, we are currently breaking the chains of infection through a thorough epidemiological investigation. However, we are far short of the speed of the spread. And we also feel very sorry for this to the public, and we will continue to exert our concerted efforts. It is not easy to balance a daily routine and quarantine measures, but this calls for our proactive participation, and we also need to continue to identify confirmed cases at an early stage. And by only doing so, we can curb the further spread of the virus here in the country. Last week, we have seen the first students to return to school after the COVID-19 outbreak, and they were the seniors of high school students. And they have also endured much of the inconveniences by wearing the face masks at all times at schools and abiding by the quarantine protocols. And we thank the students, faculty members, as well as the parents for their efforts. And we also had some confusions at first. However, it is being progressed to a certain extent. And this cannot be only guaranteed by the participation of quarantine measures by these students and faculty members, but we need to take part as a society as a whole. And today is the first weekend after the resumption of offline classes. And we ask all of the students from primary to middle school and high school students to refrain from going to multi-use facilities, including PC rooms and karaoke rooms. And we also ask the members of the public to proactively practice social distancing going forward as well. If there were some easing, I believe we need to also continue to practice strict distancing measures, and also please get tested if you have suspected symptoms. This is the beginning. Thank you very much.
There you have it. Arirang will bring you the next briefing on COVID-19 live tomorrow afternoon. That's it from the News Center for now, but we'll be back with our 6 p.m. regular newscast. Bye for now.